I would like to ask your permission to use this video for educational purpose and on internet.
Absolutely.
May I ask you how old you are?
27.
27. Now tell me about your symptoms before the surgery. That was just what, 2 months ago?
Yeah, so the surgery was February 19th.
About 2.5 months ago.
So before surgery, it was running down all the way to my feet, bottom of the feet, outside of the feet, ball, heel. It was like somebody was dragging a needle across the bottom of my foot all the time.
How long
above
was
my
it going
calves.
on?
Went on for about 5 years.
5 years.
Yeah.
So since you were 22 years old.
About 22,
Yeah.
21, 22 years old.
And you just told me about that you sought help for this stabbing, sharp, 1 to 10. How bad was that pain?
And it was usually sitting at about an 8.
8.
If I did anything to aggravate it, it was an instant 10.
Okay.
And it was excruciating to the point where I laid down all day.
And the problem we confirmed to be the bottom 2 disc. But you sought help before you met me over the years. Tell me, what's the result of those?
The first surgeon told me he wanted a laminectomy, discectomy, told me it wasn't going to help. The next 3 surgeons said we're not going to do any surgical work whatsoever.
What did they tell you?
They told me I was too young to go under the knife for that long.
Oh, that long meaning?
They were talking like 10-hour surgeries. They were going to open me up for that long to put all of that hardware in. And I didn't want it.
Yeah. And tell me, do you remember the surgery itself?
This current surgery?
The surgery that we did. How
Yeah,
long did you stay in the hospital?
I was in there for a day, less
For a
than
day?
24 hours. I was out 2 p.m. the next day.
Yeah. When did you notice leg pain is different or gone?
Oh, like 2 days after I left the hospital.
Okay.
I was walking on my feet. I was using my walker, of course.
Yeah.
But it was weird to not have the pain in the legs and feet anymore.
Okay. Now 2 other things I want to show. First of all, that we did actually 2-level fusion. We confirmed your problem is the bottom 2 disc. We did the 2-level fusion. And then this is the record of the surgery. Your surgery was in 44 minutes, not 8 hours. And our blood loss for your surgery was 126 cc, which is practically half a cup of coffee.
That's actually really interesting.
Yes. How is the daily activity?
Daily activity is pretty good. I've gone back to fishing. Before surgery, I wasn't fishing at all. I couldn't do the
twisting
pain.
and motion.
Yeah, now I'm sitting in a chair, lakeside, just kind of casting out. I put a little extra weight on the fishing rod.
Now the surgery went really well. We did exactly what we said we are going to do. It didn't even really take us long. And here are additional films that it shows all the hardware are in perfect order and in location that they're supposed to be. As a matter of fact, look at that. They're perfectly centered where they need to be and so on. And bone is healing. But now we are going to talk about your sacroiliac joint. You told me about a month ago you start having some problem in your groin. Tell me about that.
So it went from after surgery, I could feel the localized pain on the back.
Yeah.
It was for sure painful, the incisions itself. But after that, I kind of noticed that it was in the inner thigh, kind of groinal area, front of the thigh, and kind of almost down to the knees, but not all the way to the knees.
And that's very important information because that nerve you just described, sometimes the spine can cause that, but the spine would cause that problem higher up, here and here. These are the nerves that go there. But you're describing very typical symptoms of the sacroiliac joint. One side of it is the groin, the other side of it is just above the buttock in the back. And we know that once you get a surgery in the spine, your body optimizes the situation for the spine and so put more stress on the sacroiliac joint. Sometimes temporarily that pain in the sacroiliac joint get worse. Doesn't mean that we need to do anything about that. Sometimes we do injection, but that's another problem that is often neglected. Practically people go and say it's nothing wrong and just you don't it's not real and so on. But no, this is real. It can be painful and certain activity make it worse. And it's exactly where you described it, in the groin, in the thighs and so on. But doesn't mean we need to do anything about it, but we need to know that exists.
Right.
So and not dismiss it.
Absolutely.
Yes. Tell me, those surgeons that you saw and they didn't want to touch you, and because what did they say? You're too young for the 8 hour surgery?
They told me I was too young for an 8 to 10 hour surgery.
What do you think? Knowing what you know now, what would you tell them?
I would honestly, if I went and saw those surgeons again,
Yeah.
I would honestly recommend them to come and talk to you. A 44-minute surgery to do a spinal fusion is a lot better than an 8 to 12 hour surgery.
Yes,
to
yes.
get you cut open
And our result as well show that. No, you are in a lucky position that you are a young man, no other problems. There are many elderly patients who have the same problem, and they need help, but nobody touched them because 8 hour surgery can be deadly for them.
Yeah.
At least your body can go through an 8 hour surgery. They don't even have the choice.
That's true.
And that is why I appreciate your testimonial, talking about what you went through. I'm hoping that gives a lot of people additional information, okay?
Absolutely.
Thank you very much. I appreciate that.
Thank you.